The doctor picked up a leech and directly placed it on the patient's nose. Normally, people would avoid it, but the patient not only didn't refuse, he even looked pleased. But that's not all. There was also a leech on the patient's fingers and ears respectively. It didn't take long before the leeches became full and fell off. Although most people are afraid of leeches, in the eyes of doctors, they are valuable for treating illnesses. After all, the man's condition was somewhat special when he was admitted. He had multiple skin melanomas, his nose, the ear and even a finger have all turned black. Although reconstruction and skin grafting were previously done, the effect is clearly not obvious, and there are even signs of blood circulation issues. If not promptly addressed, it may lead to necrosis. The intern suggested biological therapy.
Yes.
We put leeches on her face.
No me digas.
It turns out that leeches can secrete blood thinners that help dissolve bruises and disperse them, somewhat like a large pump. An ordinary person would surely find it hard to accept. However, the man was extremely calm, as he had been hiking for 40 years and was already accustomed to animals in nature. So what was a mere leech? However, this stumped the female doctor, no matter how she explained. No matter how the leech was handled, it just wouldn't attach to the man. The male doctor quickly noticed that the leech became slightly anxious when exposed to bright light, so he turned it off. After getting the lamp, the doctor casually picked up a leech, and it really worked. The leech immediately attached itself to the man's nose and started its blood-sucking feast. The leech was indeed effective. It soon became round and full, and the blood circulation in the man's affected area improved considerably. The leech was probably too full, as it directly fell off. Surprisingly, the man became emotionally attached to the leeches and insisted on taking them home as
Me
pets.
gustaría quedármela si pudiera.
The doctor actually took out a sharp razor blade from the woman's belly, and the chief surgeon was dumbfounded on the spot. How could a blade end up in her stomach? Even though the doctor had seen numerous patients, this situation was a first. But